Good afternoon, I'm Abby Walker, and in this video I'm going to be demonstrating how to insert an NG tube, feedings, and then how to disconnect. I'm going to let you see my surroundings real quick. And then I'm going to go ahead and get started. So, the reasons that you might need to place an NG tube, it could be for decompression, feedings, lavage, or compression. And then once you know the reason why, you verify your physician orders, gather your equipment. You want to identify your patient by their name, date of birth, any allergies they might have. You wash your hands and you put on your gloves. After that, you position your patient into high Fowlers. You want to drape them with a towel, and then you're gonna want to give them a basin, tissues, and some ice chips and water if they can swallow. After that, you can occlude one of their nares to check for patency. You ask them to blow. Then you pick your nair and you get your tube, and you want to measure from the tip of the nose to the tip of the ear and then down to the xiphoid process. And you tape that, and then you're going to lubricate 3 to 4 inches. Now you're ready to insert, so you're going to go down and backwards, and you're going to want to ask them to tuck their chin to their chest as you advance and to swallow. If they have any signs of distress, such as coughing, gasping, cyanosis, or they can't talk or hum, you want to discontinue. But once it's in place, you can tape it temporarily, and then you are going to check the pH. You check the pH by aspirating a small amount and placing it on an pH strip. So you aspirate a small amount, put it on your pH strip, and it should read between 0 and 4 if you are in the stomach. So anyway, you send them down to get a chest x-ray, and if it is for sure in place, then you can tape it using the pants method, where you have 2 little strips that you tore. You would put it on there and wrap the little strips around. So now that you know that it's in the right place, you can go ahead and start your feedings. You always want to shake your formula. You shake it, you would pour it into your bag, and then you connect and prime all your tubing. Then you need to check your residuals. So you do that by pulling up 10 milliliters of air first, so a small amount of air that clears the tube, and then you're going to pull up whatever's in their stomach. If it's less than 250, you return it. If it was more than 500 or more than 250 twice in 1 hour, you would need to discontinue. But this is good, it's just a little bit, so you return it, and then you're going to flush with 30 milliliters of water. So flush with water. After that, you can connect your feeding, and you turn it on as ordered. So connect your feeding. If it was a bolus feeding, you would let gravity, let it just flow down, and you would flush 30 milliliters whenever it was all done. But if it was connected to a pump, it could be continuous or intermediate. Continuous feedings, you need to flush every 4 hours, 30 milliliters, or if it was an intermediate, you would flush before and after. So you also need to check your residuals every 4 to 6 hours, or depending on your agency's policy. And you will also replace the feeding bag and the tubing administration set every 24 hours. One last thing you do, if it was abdominally placed, you would clean and assess the site every 24 hours daily. Now that his feeding's complete, you're ready to discontinue. So you would discontinue your feeding, clamp it, and then you want to remove the tape off of their nose, and you want to go ahead and tell them to hold their breath and you are slowly and steadily going to remove. You dispose of that into biohazard. You want to provide them some nasal and oral care, and then you can take your gloves off. You wash your hands, and you're going to document the size and type of tube you used. You want to document which nair you chose, the description of their gastric contents, verification of placement. Then you're going to document their feedings, residuals, the assessment of the abdominal site if it was abdominal, and then any nausea they had, their intake and output. When you remove the tube, you document that, and then you document the overall patient response during all those procedures. And that's all, I believe. Thank you. I hope you have a good day.